Log roll the patient on their side away from you. Position the sling so that the handles and logo are facing the mattress. Tuck half of the sling under the patient. Center the sling on the patient's spine with the top of the opening of the sling even with the base of their tailbone. Roll the patient toward you and pull the rest of the sling out the other side. Lay the patient on their back. Make sure the sling is centered underneath the patient. Lift the patient's left thigh and pull the left wing of the sling under the patient's thigh. Then place the excess wing over the top of the patient's left thigh. Repeat this step on the right thigh. When you are completed, the patient is now ready to be lifted. Note, if the patient's legs are extremely rigid, it may work better to bring the left wing under the right thigh and the right wing under the left thigh instead of going between the patient's legs. Position the lift until the green rubber hose is over the patient's chest. Make sure there are no cords or other objects under the bed that would obstruct the wheels of the lift. Each sling has 3 different loops. These loops are used to determine the position of the patient. The shorter loops bring the patient to a more upright position, and the longer straps leave them in a more reclined position. Typically, applying the shorter loops on the back and middle loops on the front provides a comfortable transfer. Attach the straps by the patient's shoulders to the lift using the shortest strap. The hanger should be positioned as shown and be parallel to the patient's shoulders. Take the wing that is lying over the left leg and hook it on the right hook on the longest loop. Then take the wing lying over the right leg, cross it over, and hook it on the left hook on the longest loop. The patient is now ready to be lifted. Push the up button on the hand control. Once there is tension on the loop, double-check the loops to make sure they are securely in the hooks. Start lifting the patient to the desired height. If the patient is not able to support their head, assist them or use a head support sling. Lift the patient's knees and smooth out the sling under the thighs. Then, continue lifting the patient to the desired height. There may be instances when patients with extremely fragile skin will require a different sling, such as a multi-purpose sling. With the spreader bar and legs opened, position the wheelchair under the patient. Stand behind the wheelchair and hold both of the side handles on the back of the sling or the middle handle. Hold your hand level and lock your hand against your stomach as the patient is being lowered. When the patient is 1 inch from the seat, grab the handle and position the patient comfortably in the wheelchair. This will ensure that the patient will be seated in an upright position when fully seated in the wheelchair. Unhook the sling from the Easy Lift and back the lift away from the patient. Lift the patient's knees, pulling the sling wings out from underneath the patient's thighs. Lean patient slightly forward and grasp the top of the sling and pull the sling out from behind the patient. If you choose to leave the sling in the chair with the patient, simply tuck the wings between the patient's legs and the sides of the chair. We will now demonstrate how to transfer a patient from a wheelchair. When standing in front of the patient, lean them forward several inches to facilitate the positioning of the sling behind the patient. With the sling handles and Easy Way logo toward the chair back, place the sling behind the patient, keeping the center handle of the sling centered on the patient's spine. Make sure the opening of the sling touches the patient's tailbone. Position the wings along the inside of the chair. Place your hand between the patient's hip and sling with your fingers pushing down on the edge of the sling to the chair bottom. Lift the patient's left knee and with a tug, pull the left wing of the sling under the hip and thigh. Place the excess sling over the left thigh. Repeat this procedure on the opposite side. This procedure will ensure that the sling is under the patient's bottom, with the patient's weight evenly distributed on the sling. Use the spreader bar to spread the legs wide enough to straddle the wheelchair. Position the lift so that the green rubber nose is now in front of the patient, with the hanger spreader parallel to the patient's shoulders. Attach the lift shoulder strap to the left hook and the right shoulder strap to the right hook. Take the right leg wing and attach it to the left hook using the middle loop. Take the left wing and attach to the right hook using the middle loop. Push the button on the hand control. Lift until there is tension on the wings of the sling, making sure all of the loops on the sling are securely hooked on the sling hanger. Then smooth the sling's wings under the patient's thighs with a slight pull on the outside seam of the wing. Lift the patient off the chair. Once the person has been lifted, they are ready to be transported. When using the Easy Lift for transferring patients, lower the patients so that their feet are resting on the base. This will make the lift control and turn more easily and give the patient a greater feeling of security. Easy-Way slings are designed for easy toileting. After the patient has been transported to the bathroom, position the lift around the toilet and lower the patient. Now demonstrate how to lift a patient from the floor. One person can lift a patient from the floor, but it's easier when there are two people. Place a pillow under the patient's head. Position the sling using the same procedure used when transferring the patient from a bed to a chair. Log roll the patient to position the sling underneath so the handles are facing the floor. Using the center handle as a guide, center the sling on the patient's spine with the opening of the sling even with the base of the tailbone. Make sure the sling is centered underneath the patient. Lift the patient's right thigh and pull the right wing of the sling under the patient's thigh. Repeat this step on the left thigh. When you are completed, put the straps on the patient's chest. The patient is now ready to be lifted. Move the lift into position around the patient. Lift the patient's legs to one side, pushing the lift forward until the green nose cone is centered on the patient's chest. Then lay the patient's legs over the base of the unit. Lower the lift boom and hook the straps to the lift hangers using the longest loops and shoulder and leg straps. Support the patient's head and start lifting the patient. When the patient is off the floor, rotate the patient's legs away from the mast. Continue lifting until the patient is at the desired height. Roll the patient into position next to the bed. Swing the patient's legs up and around and center their feet at the foot of the bed. Reposition the patient so they are centered on the bed. Lower the patient. It's recommended to support the patient's head during this step. When the patient is fully lowered, remove the sling straps from the sling hangers. Using the log roll method, remove the sling.